Good afternoon, guys. I hope we're all sparkly. If I look tired, it's because I'm tired. It's been a very challenging day. I went into work early, as I do every day at 7 o'clock, to do emails, and the internet was down. I had to use a hotspot to get access to emails and our patient platform. It is what it is. I set HRH onto the task of sorting it out because I had to focus on, guess who? Yeah, you, the patient. And it takes all of this. It can be quite stressful. It is quite stressful because the premise behind TRT might be normalization of your male androgen levels, but the focus of my attention is addressing psychology, because the cardinal presenting symptoms of low testosterone are an element of low mood, anxiety, and depersonalization. And we're constantly working with you guys to help optimize everything. So we like to have a holistic approach to medicine, to TRT, to everything that we do. So I'm always exhausted at the end of the clinic, but I'm psychologically exhausted. So as I've said before, we're physical beings in a world of psychological stress, and you need to release that stress physically. So I hit the gym, leg day, my favorite day, the worst day of the week. It's the best day because it's the most challenging day, because it's the hardest day. So we talk about the need to earn your reward, Dexter, on cue. Earn your reward, but rest well. Because what's the key? Yeah, you guessed it, balance. Lydia and I have worked incredibly hard over the last 7.5 years to help raise awareness of the importance of testosterone in physical and psychological well-being. 4, we've burnt the candle. It's been a challenge, but it's been worth it. We have a very successful medical clinic, which now attracts people from 40 different countries outside of the UK. Wow. And last week we had somebody travel across from America just to come to the men's health clinic, because he's obviously seen the YouTube channel, he's read the website, and understands our focus is on education and optimization of your male androgen levels for long-term physical and psychological well-being. Disappointingly, he was on a massive dose of testosterone because his clinic focused on resolution of symptoms, and they thought the way you did that was just keep increasing the dose, not realizing what life is all about: balance. And we talk about that seesaw effect with your neurotransmitters on one side and cortisol, and your calming male androgen levels on the other one. So he was on 50 milligrams of testosterone cypionate daily. How absurd is that, with the average man producing between 6 and 10 milligrams a day? Ludicrous. How did he feel? Not very good. So he showed due diligence, did his research, and found comfort in what we offer. Hopefully, a common sense, no nonsense approach to TRT. No false promises, realistic expectations. We can optimize your male androgen levels, but you have to put the hard work in, day out, to do what? Yeah, you guessed it, earn your reward. But how crazy is that? He traveled all the way across from America to sunny Dorset to see us here at the Men's Health Clinic. Quite humbling. Well, very humbling actually, because he said during the consultation, I can afford it, so I wanted to travel over and see the best. Wow, thank you. Yeah, we do work tirelessly to give you a sense of perspective that's disappointingly lost in medicine and on social media with false promises. What we want to aspire to achieve is normality, not average, but normality. Optimization, normality. Because it's all about what? Yeah, balance, stability, earning your reward. There we go again. One more time. I'll be saying that loads over the next few years because it's about drilling it home for you to understand how important this concept is. You need to have contrast in order to establish balance and harmony. Yin and yang. So, kind of crazy really. The clinic's been open now for 7.5 years. And we've got over 1,500 patients from all over the world. Crazy. But we put the work in, and hopefully you guys have seen what is common sense and logic. And we need to apply that to medicine. Not distorting physiology, normalizing physiology for long-term physical and psychological well-being. One more time, not one more time, loads more times. Now, last week was pretty crazy because we also had a couple of emails from doctors. We do get emails from doctors, but this time, one was a doctor from the United States, an endocrinologist, who wanted to come over to sit in with me in clinic to learn how to safely and effectively microdose testosterone, cypionate and HCG. Another was a doctor in Canada who wanted me to advise him how to safely and effectively add HCG to his young patients for fertility. Now it's crazy. Recreating the HPG axis with testosterone and HCG has led to over 50 successful conceptions. Today, we had yet another email from a patient saying his wife is pregnant. He said HCG should have a health warning. Now, I did tell you, it's not my fault. Please name him Rob or Lydia if it's a female. But it's quite crazy, really. Patients have understood our philosophy, and now clinicians are understanding our philosophy. And they want to learn how to safely and effectively manage their patients, because that should be our focus, obviously. So every decision that we make at the Men's Health Clinic is always in the best interest of the patient, as it should be. Do no harm, always act in the best interest of the patient. And I think that's why we are where we are, because we put the effort in to do what? Yeah, you guessed it. Earn our reward, so we can help you earn your reward.